The Democratic Nursing Organization of South Africa announced plans to protest against concerns regarding unpaid nurses. Denosa will picket outside the Provincial Department of Health, among other locations. The organization demands the Health Department CFO, Lerato Mayo, to be held responsible for the non-salary payments of its members. Denosa's Gauteng chairperson, Simphiwe Gada, spoke during a media briefing following reports that its members have not been paid for more than 3 months.
We will be visiting the Premier of the province. We are going to mobilize to visit the Premier of the province. We'll also be visiting Treasury in the province because we believe that Treasury must also allocate enough funds for the Department of Health in order to meet its mandate. We will also be visiting the Department of Health demanding that the current CFO, Lerato Mayo, has got to face the consequences and also be held liable for these nurses that have not gotten paid, because this also rests with her office in that she has been present in all the meetings that we have held with the Department of Health, where she has also been on record saying that finances are not a crisis in the Department of Health as far as paying of these nurses is concerned. So we will be mobilizing throughout. We will be inviting all the nurses in this province, because this is not about the nurses that have not been paid, the post-community service nurses. This is about defending the dignity of the nursing profession. So all the nurses in Gauteng, we will be calling them and taking to the streets to demonstrate that we are tired of talking in the boardroom and agreeing on things in the boardroom. At the end of the day, those decisions that we have taken in the boardrooms are not being honored by the department.
Our reporter Tumaole Mohlaoli attended Denosa's media briefing in Bramley, Johannesburg, and joins me now live from there with a breakdown of what came out of it. Tumaole, good afternoon and thank you for joining us. Now, it seems as though Denosa and the department are not fully finding each other, especially when it comes to the trust issues between the parties, even though government has promised to pay those nurses by next week.
Indeed, and what Denosa is saying is that it feels that it doesn't have that trust relationship with government, because it feels government has failed it at every turn. They say that this crisis in the health sector has been long coming, and they have tried at several points in the build-up to where we currently find ourselves to engage the government, the provincial health department here in Gauteng, to try and bring the concerns, the challenges, and some of the challenges really that face nurses to the fore. Now let's hear more from Sichaba Singange, who is a Denosa shop steward and is one of the young nurses in the profession. Sichaba, what are some of the key challenges you face, and what are the key challenges you have been trying to communicate with the provincial health department?
Thank you, Tumaole. The main concern is getting people employed, but before that, what needs to happen is that people need to get paid. We've got people that have gone on for over 3 months without pay, and it's really uncalled for. It's not something we've tried and negotiated with the department. We've sat in boardrooms. A task team was created by the HOD at the time, who has since resigned, that we come up as organized labor, as well as with the employer. The employer is comprised of finance, it comprised of quality control, it comprised of nursing directorate. We all came together. At that moment, we all thought that we were working towards the same goal, only to find out later on we are told that no, the CFO is saying there is no money, which is utter lies on a Tumaole, because when we were part of that task team, we went through the PESAL system, which gave us that actually there are vacancies in the system to be able, one, to pay people, secondly, to employ people permanently. Now, later on, the CFO came back and said, but I don't have money. We're not asking for money. We're saying activate those posts that are on the system and make sure that the frailing healthcare system gets the assistance that it requires.
And in terms of the various, if I can call it levels, there seems to be also a differentiation between those who are seen as trainee nurses, those who are seen as active nurses. What has caused that discrepancy, and how does it work? How does it play into the crisis that we find ourselves in now?
Okay, I'll firstly just briefly explain the differences. So now what happens is when you study for nursing, whether you are at university, whether you're at a nursing college, you become what we call a student nurse. And then from there you have 4 years for you to qualify in either university or college. You'll have your 4 years. So now from there you move to what we call a community service. Community service is not restricted to just nurses. All healthcare workers that whether you are a doctor, whether you're a dentist, pharmacist, you'll have to go through that. So that is mandatory. So now what happened here is that as soon as these nurses, they completed their course, they were moved to community service. But now that's where the challenge began, because previously they had a contract with their institutions, be it a university or a college, because that's where they were getting their stipends from. But as soon as the 4-year contract ended, the institutions cut them off, meaning the Department of Health is now supposed to take over, which is what hasn't been happening. So now you can imagine, Tumaole, you are supposed to wake up every day and report to work. One, you don't have transport money. One, you are renting where you are staying. One, you've just completed a degree that is of demand. So at home as well, they're expecting you to say, you know what, our lives will be better now. You are now somebody important in the community, only to find out that you didn't get paid. Now, what happened is, like I said off air, that I get calls on a daily basis from nurses that are currently doing their ComServe and those that have just completed their post-ComServe. People don't have toiletries, people don't have food, people they are being chased out of their places where they are renting because landlords cannot take it anymore. There's excuse after excuse. And we as well as organized labor, we keep saying, okay, but we have sorted this out with the department and all is well. They will send out a circular to say, the current circular said people need to be paid by the end of June, which is the 30th of June. It was between the 9th of June and now. Only to find out that no, it was just a circular to get organized labor off their back. Yeah, that's where the challenge is right now. Like I said earlier, we have done the talking. We are done talking. What needs to happen now is implementation. We are not asking if the department has capacity to employ the nurses. We know for a fact that the department has capacity to employ nurses. They just need to get those activated. We've seen it happen. I was part of small regions where we actually went into the region and it happened. It just needs to happen throughout the entire province, and not just the province, the entire country, because as Denosa, we are in contact with other provinces. They are facing the same challenge.
Right. And the next question then would be, what is the way forward if this doesn't happen? As Denosa and as nurses, you are seen as a critical and a key service to the nation. Therefore, one would think that you are not allowed to strike as other sectors would be, whereby all workers down tools because you're an essential service. How are you going to manage that contradiction or that particular challenge?
Be that as it may be, people, like I said, people are expected to go to work. So now, if I am not paid, I don't have transport money, I don't have money for toiletries, I sit at home. What happens to the department? It suffers. That's one way of us saying we are now making our voice, that we can't keep getting abused by the system. But as soon as tomorrow, we will announce our plan going forward. For me right now, it's quite premature to announce as to what is it that we intend to do. But as soon as tomorrow afternoon, we'll let the nation know as to what is it that as Denosa, Gauteng, we intend acting going forward.
Thank you very much. That was Denosa shop steward there, Sechaba Singange, just giving us what the plan is, and we will keep a close eye on that expected announcement tomorrow as from Denosa Gauteng on what the way forward is. But judging by what he said, numerous challenges and a lot of frustration on the ground from ordinary nurses who are tasked with ensuring that the health system is smooth and runs smoothly in terms of patient care. With that, is back to you in the studio.
All right, thank you, Tumaole, for that wrap-up and the briefing that happened with Denosa with regards to the nurses that have not been paid for the last 3 months.